Welcome to Part 11 of Neurologic Disorders. This lecture will address ADD and autism. So ADD is attention deficit disorder. ADHD is adding hyperactivity along with the attention deficit. It's many times misdiagnosed and most frequently in the males. And the misdiagnosis isn't that we're missing it, it's that we're overcalling the diagnosis. The behavior patterns that these children exhibit is an inability to sit still and pay attention and focus on something. They do have difficulty with impulse control, and when they have hyperactivity, they can't sit still. When we have to take care of children like this, one of the first things that the parents do is bring them into the doctor, because after all, there must be a pill that we can give them that's going to make them stop behaving the way they are. So our job is to set realistic expectations on the parents, the teachers, as well as the child. We need to give them very specific instructions, and we're going to need to repeat those instructions. Give immediate feedback to these kids. Let them know when they're doing well. Let them know when they're being inappropriate. And you still want them to develop a good sense of self-esteem so that they're not always feeling belittled and then they become depressed. When they need to focus on something that's important, it's good for them to be put in a quiet environment. You've probably all heard about the medications that are available for these kids. Ritalin is the most commonly used because it's the oldest. Dexedrine is another derivative, and then we have Adderall. And here's some more websites that have to do with ADD and ADHD. Now, do remember that the most common behavioral disorder affecting children is labeled ADHD. So 2 to 3% of the population, 2 million kids in the U.S., that's a lot of kids. So that means in a classroom of 30 kids, at least one child has ADD or ADHD, and you know how disruptive that can be. It can be very disruptive in a hospital setting, in a clinic setting, as well as in the home. So we have behaviors, and these kids need to have 6 or more of these characteristic behaviors before they're being labeled, because it's not a good label to have. Developmentally inappropriate, they do have disruptive behavior. These behaviors must be going on for more than a 6-month period of time. And then they have to have categories of behaviors: inattentive, impulsive, and hyperactive. And then they have them in little subgroups. You don't have to know all that, but just know that these are the characteristic behaviors associated with ADD and ADHD. And you know, at some point in our lives, we probably all would fit into this category. When we have these kids in front of us, we must be very clear when we're communicating. We need to get their attention, we have to look them right in the eye, and we have to be specific about what our expectations are, what we'll tolerate, and what we won't tolerate, as well as the consequences for not following the rules. They need consistency, so in a hospital environment, it would be really good if the same nurse could take care of this patient day after day after day, or the same 2 nurses, because once again, you're only working 2 or 3 days a week. Provide structure. See what the structure has been like in their own home environment and imitate it as much as we can. Set a good example. Don't lose your temper when you're taking care of these kids. Anticipate problems. Know what their trigger points are. Try and avoid their triggers from happening. Look at the big picture. That's what we want them to do. We want them to see the big picture. Don't focus on the small stuff, right? The caregivers and their siblings also have needs because they have to take care of this child, or they have to be worried about this child, or they must interact with this child 24/7, 365. And we need to get the schools and the counselors involved and other support systems, including support groups of other families that have the same type of behavior going on within the confines of their home. So once again, on the management, we have the stimulants. And isn't that weird? They're already hyperstimulated and we're giving them stimulants. And that's because they have that tachyphylactic reaction. They have the opposite effect. If you or I took those medications, you would not be sitting in the classroom. You wouldn't be able to sit and listen to video lecture. You wouldn't even be able to sit and read the book. But you give it to a kid who truly has ADD and ADHD, and they respond very well. Strattera is a newer medication and it's a non-stimulant. More study needs to be done on this, on how effective it is, as well as the side effect profile. And then we want to get these families and the child into some type of support network. And then lastly, we're going to talk about autism. I already posted a video on Blackboard that explains and portrays the behavioral characteristics of the disorder. And what's good about this video is you're going to first see what normal behavior and expectations are, and then you're going to see a child who has autism. And you can really see the areas that they have deficiencies. When we're taking care of an autistic child, there's a wide spectrum of disability. To those who simply have no social skills, to those who can't even do simple things for themselves. Your nursing care, you want to observe the behaviors and their ability to interact socially. And this can be as simple as, can they answer a question that you're asking? You need to ask the parents, how does this child communicate? How do they tell the parents when they're having pain, when they want something, when they're unhappy? Because what we don't want to have this child do is start doing self-destructive activities right in front of you because you don't know how to interact with them. Once again, following the routines and the habits that this child is used to at home, in the hospital or clinic environment, is a key to your success. Minimize touching. So this is another thing you want to get from the parents. How does this child respond when they are touched? Because some will totally freak out if you come near them. Provide a safe environment so that they do not harm themselves and they do not harm you either. And then provide resources and referrals for parents. As you are working in the field more and more, you will become more aware of what's available and then make those referrals to them. And this ends the lecture on ADD and autism.